The first thing is that even though these are malignant tumors, they are among the slowest growing malignancies in the world. And even with the diagnosis of neuroendocrine tumor, most people can live a long and generally healthy life despite that diagnosis, as long as they're being treated properly. And there's tremendous hope and tremendous opportunity to make that happen. That's a really tough question. I would say that in some general terms, people are familiar with it at all the major cancer hospitals. But on the other hand, a lot of cancer hospitals that are very famous and treat cancers of all sorts very well have very little familiarity with this particular disease. It really depends on whether they have individuals associated with those centers that are highly experienced in neuroendocrine cancer. So you could have a center that is a world-class center for treating colon cancer, or pancreas cancer, or stomach cancer, or lung cancer, whatever, but may not have a specialty interest in neuroendocrine cancer. So there's no blanket rule, but I think in any particular city, in any particular state, you're more likely to find more experienced people at a major cancer center than in a little private practice office, someplace where somebody might have seen one or two in their whole career. Well, that's something that I've been working on very, very hard. Not only do I like to give educational information out to the patients, which I'm doing right now, but also I'm very involved in lecturing and teaching and writing and teaching other doctors every possible way to be aware, going to tumor boards, going to national meetings and discussing these things with all different specialists. Gastroenterologists need to be alert enough that they can pick up the diagnosis early if somebody has unexplained diarrhea or some unexplained bowel symptoms. Other specialists need to know. Unfortunately, even today, with all that we know, most people who have a neuroendocrine tumor are misdiagnosed, often for years, see multiple specialists, waste a lot of time, a lot of money, a lot of aggravation, trying to figure out what's wrong when a simple test might be able to get to the bottom of it. And an average person might go 3 to 5 years before the diagnosis is made and see maybe 6 or 7 doctors and have multiple visits, sometimes multiple emergency room visits or even hospitalizations before the appropriate test is done. And it's very, very sad to see that happen. I hope that the situation is going to get better, but myself and all the major advocacy organizations and centers that treat these cancers are all working together to try to get the word out that it's important to make the diagnosis as early as possible and to treat properly.
And that's a big goal of this series, is to help people like you avoid all those things that Dr. Wolin was just talking about. So the more that we can spread this information, spread awareness, I think the more it's going to help everybody in this community.
Well, I think probably the easiest place to start is to go on the webpage of the Carcinoid Cancer Foundation. The webpage, as most of you may know by now, is called carcinoid.org. And on that webpage, you'll see an item that says Find a Doctor. And if you click Find a Doctor, you can then go to the appropriate state, the appropriate city, and you can try to find a specialist in your area. They also designate people who are experts and people who are familiar but not necessarily experts, but you'll get a lot of information and look for the specialty. If you need somebody to treat cancer, you find a medical oncologist. If you're looking for a surgeon, you can find a surgeon who is a designated expert. These are very rare tumors. If you lump together all types of neuroendocrine tumor in the United States, together it's maybe 5 people in 100,000 Americans get neuroendocrine tumors. And for many of these neuroendocrine tumors, the incidence is much, much less. And in some cases, it's less than 1 in a million. So the general doctors are not particularly familiar with these kind of diagnoses and the specialized treatments available. So I think it's ideal. The other thing is, if you see a specialist, you often will be able to have access to a whole specialty center. We have a carcinoid and neuroendocrine tumor center at Mount Sinai with a weekly neuroendocrine tumor board that meets every week with roughly a dozen patients discussed in detail, and the whole group of surgeons and endocrinologists, gastroenterologists, pathologists, radiologists, interventional radiologists, all different specialists, all get together and we look at all the pathology and the radiology and can make treatment recommendations based on the sum of everybody's experience. And that type of focus on individual patients from so many different angles is hard to come by in the general world. And we can always work closely with your local oncologist, your local care team, and make recommendations about what's possible and what's new. Another great question. There is no specific NET certification like there is for so many other specialties in medicine. It's a very rare tumor, and NET specialists in this country come in different flavors. I'm a medical oncologist. There are some NET specialists who are gastroenterologists. There are some that are endocrinologists, or some that are surgeons. And it's a multidisciplinary specialty and requires lots of dedication and training, but not there's no certification program officially for NETs. I think that's changing. We're all trying to help educate younger people and develop a new generation of doctors who have experience in treating these tumors, but it's really a challenge. And the number of centers that specialize in neuroendocrine tumors and the number of physicians who specialize in neuroendocrine tumors is quite limited. In Europe, there's an organization called ENETS, the European Neuroendocrine Tumor Society, and they actually have a formal certification program and will designate certain centers as centers of excellence that meet certain criteria. We don't have that exact situation in America right now. Well, like I said in the very beginning, I think there's enormous hope. Most people do well. Most people live for years and years with quality life, as long as their cancer can be treated properly. And I wish everybody a long, healthy, happy life, with or without neuroendocrine cancer. It's been a pleasure talking to you.